everyone, and welcome back to our very short series on borderline personality disorder. Last video, we started talking about the disorder and what it can look like. And this time I want to talk a little bit more about what loved ones of people with this disorder tend to observe and tend to be quite worried about. And then just give a brief explanation as to why they happen. Later on in this series, I will be providing some resources for family members and for people with borderline personality disorder, just some additional reading so that you're able to access that. But I'm going to do it at the end of the mental health series I've been doing because I'm going to put a lot of resources into one video. So, borderline personality disorder, if you have a loved one who's been diagnosed with this disorder, people tend to become very concerned about the unexpected explosions of anger, or often they'll say, they feel like they're walking on eggshells a lot. There can be some threats of ending one's own life. There can be some threats of harming oneself. A lot of times, because a person with this disorder feels a lot of internal distress, they can also fall into really unhealthy ways of coping with that distress. So they may be, engaging in some really reckless sexual behavior. They may gamble, they may use drugs, they may drink. And there can also be some intentional self-harming. And a lot of these behaviors look very scary to the people around the individual. And I think the most important thing to keep in mind when you're starting to observe these as part of the disorder is, first of all, this is something your loved one is going to need some professional help with, some professional intervention, because there are certain things that you as a loved one are not going to be able to help the individual with just because the behavior is so complex. There are some areas where holding firm, secure boundaries with your loved one can be very helpful, or choosing not to step in and try and negotiate with them when they're in a point where they have very high levels of anger. I think the most important thing to remember, however, is that people with this diagnosis, even though they show a lot of challenging behaviors, these individuals, they're not bad people. They're not people who do these things because they're trying to be difficult or make trouble or anything along those lines. All of these behaviors, even some of the most challenging ones, are because this individual is trying to cope with overwhelming levels of emotion internally, and they don't know what to do with it. And so they're going to seek outlets. And sometimes it is an emotional explosion, even though afterwards they may feel really badly that it happened. Sometimes it is seeking out a substance that just eases the internal pain that they're feeling. Sometimes it is self-harm to ease the internal pain. Sometimes people will threaten or sometimes even attempt ending their own lives because they just want to get away from everything inside. And so when you're seeing these kind of behaviors, it's really important to keep that in mind. And if you have the diagnosis yourself, it's very important to keep in mind that you're doing what you can to cope with what's happening inside you. And you're not a bad or a broken person. Your emotions are simply overwhelming. And it is possible to get help to manage those emotions and to learn to work with them in a healthy way. And so finding a psychologist who is a trained expert in working with personality disorders can definitely help, because they'll be able to get you on your way to being able to maybe bring some calm back into your life and kind of allow you to feel a little more settled internally and manage those overwhelming emotions. I hope that was helpful. Our next topic of discussion in a few weeks will be bipolar disorder, and just a little chat about that one because it often gets mixed up with borderline personality disorder. So I just want to chat a little bit about what it is and how to tell the difference. Thanks. Have a great evening.